The need for in home care is exploding. So is the cost. And with a severe worker shortage, finding qualified, compassionate caregivers feels nearly impossible. Many families are left with heartbreaking choices, struggling to provide the care and dignity their loved ones deserve. But what if there was a different way? A solution that addresses both the affordability and the caregiver shortage. Today, we're going to explore a new approach to in home care that's changing the game for families and caregivers alike. Welcome to Fading. Welcome back, listeners. I appreciate every time you join us for a talk. I am very excited today to bring you Neil Shaw. He is of CareYaYa, and you've probably not heard of that, but you are going to be so thrilled that you tuned in to listen to this conversation today, because Neil is becoming a positive disruptor in the in-home care industry. So thank you for joining me, Neil.
Thanks for having me, Jennifer. I really appreciate it.
And Neil's a very busy guy. We've tried to do this recording a couple before, and we gotta get going because he's got an investor call after this call. So Neil is a previous caregiver, so he's totally familiar with what our world is like. So Neil, why don't you tell us about your background and how you came up with this ingenious plan for in-home care?
Sure. So I'm the CEO of CareYaYa. It's one of America's fastest growing care platforms in the country. And my background is kind of non-traditional. I became a caregiver in my mid-30s. Quick summary on myself is prior to this, I was living in New York City. I was in investment banking and then went into hedge funds in my mid-20s and became a partner at a multi-billion-dollar fund. By my early 30s, I started my own fund backed by some investors, grew that from 10 million to 250 million under management by the time I was 35. And, I was good. I was good at finding investment opportunities, specialized in turnarounds and restructurings and, just kind of like more of like a traditional financial analyst. And I found myself suddenly becoming a caregiver in my mid 30s, actually starting in my early 30s, first from my grandfather, observed the care journey through dementia, kidney failure, cancer, and then end of life care, where, I was the person in my family, like helping manage and coordinate a lot of care. And really I saw my mother bear the brunt of like the direct caregiving. And that was like eye opening to me of like, wow, there's this huge care economy, that is desperate for better solutions. And when you can't get good care help, family members end up feeling guilty and end up doing it themselves, and that was like eye opening. So at that point I was still running my fund and I started really researching the care economy and the care industry, thinking there could be some cool innovation opportunities to back. And then at the peak of my fund career at 35, my wife became severely ill and went through years of cancer treatment and multiple different therapies and hospitalizations. And I was managing her care full time while running my work. And I kept taking sabbaticals to manage her care. And at some point, it just became untenable. And I basically wound down my fund and became her full-time caregiver. Knock on wood, after a couple of years, she had a successful outcome and has now been in remission for several years. And at that point, I was like really obsessed with the care economy. I'd experienced a problem secondhand and firsthand. I'd been in so many dementia support groups, cancer support groups, and just like talked with so many family caregivers who were like experiencing this. And I was like, I was at that point, I kind of almost had a midlife crisis, if you will, now in my early 40s. But I was like, okay, I've gone halfway through my life, but full transparency in finance work, the impact is not as direct. And I was like, okay, here's an industry and a huge opportunity where I can like put my brains and my energy to good use and make a positive impact. It's an unsolved problem. And it's a huge economy that is going to double or triple over the next 5 to 10 years as our population ages and rates of chronic disease are rising. So that was really the genesis. I thought that there was so much room to innovate. I couldn't believe in, today here we are in 2025. I can't believe that there's not as much innovation as you'd expect and as you've seen in other industries. So yeah, I think it's a huge unmet need and a huge opportunity. Both personally I've experienced it and professionally. So yeah, excited for the opportunity.
I think part of the problem is we don't talk about end of life care, end of life as a society. It's like, ooh, I don't want to think about it, don't want to deal with it, so we don't. And I think because caregiving lands on women, unfortunately, it's kind of expected, and women leaving the workforce to raise kids or take care of elderly parents or whatever is just kind of a given. And I don't think enough people, and this is what I'm trying to change on my end of the stick over here, is making corporations understand that this elder care crisis and this caregiving crisis is costing you money now. It's just going to keep getting worse. And if we don't address it, like Neil is doing, we're going to have a really messed up economy, because you cannot have people just constantly leaving the workforce and hoping that they can get back in their 40s or mid 40s. Or, my dad died when I was 50 and I took care of my mom for 3 years. Going back to the workforce after, in your mid 50s is not generally easy at all. So, yeah, we need a bright light to shine on, like, our society and our culture overall, because, we're putting our head in the sand, and it's not going to be pretty if we don't turn that around real soon. So you came up with this bright idea for CareYaYa. Why don't you tell everybody what that is?
Yeah, sure. And Jennifer, I totally agree with you. And I think we're heading towards a care crisis, if not already in one, for a variety of reasons. I think unaffordability of care, lack of social supports, shortages of caregivers, et cetera. So, I'm trying to do the best I can from like private sector innovation, but I also think we could use a lot of help from policy, federal government, state and local government. I think as well as like other organizations stepping up. So you're right. I think it's one of the biggest crises of our times, especially with the aging population. So our innovation is like, kind of like born out of personal experience and my observations, where I thought there was an opportunity is, I observed in the direct kind of home care industry, there's really two paths that I found most families to get care help. One is like the current paid care agencies path, which is typically like a franchise or franchisee model operating in most cities across America. And it's like a staffing with a markup, so I'm in North Carolina, and around here, the care is around 30 to 35 bucks an hour through local agencies. And they're turning around and paying the caregivers like less than half, typically like 15 bucks an hour or so. So it's a big markup. And then, it's really justified by local economics. Local franchise operators are trying to profit maximize over getting like 100, 200, 300 people using it. I think that is pretty broken, in terms of most people either find an affordability issue, most people find quality of care isn't great because the care workers aren't getting paid that much. And then there's an inconvenience of booking. So, let's say something like 30, 40% of people use that. Then the majority of people are transacting the gray market, finding caregivers on their own, going through support groups, posting on care.com, putting up flyers at their local church, just asking for friends and family, who they can get for help, and then just paying them directly. So that's how the care market works. So our initial innovation was, I'd found through my care journey that some of the best informal caregivers out there were healthcare focused college students, people in nursing schools, pre-med, pre-physician assistant, somebody who wants to go into a future clinical career. I was like, okay, these people are making exceptional caregivers. I and other people are finding them in the community, posting flyers, et cetera. There's a convenient way to get them. And what if we could pair that with innovations like Uber or DoorDash, like a gig economy tech platform where this could be done for you and available for you? So we launched that innovation. Now it's been almost like 3 years ago. We launched in our area. We're based in Raleigh-Durham, North Carolina. So we launched it at Duke University and UNC Chapel Hill. And the idea was pre-med students, nursing students, et cetera, would be available on our tech platform, that anyone could go to CareYaYa.org, CareYaYa.org, and book care at days and times they need. We'd run the entire backend technology. We'd vet all the students, run background checks on them, interview them, verify enrollment, et cetera. And then they'd be available for families that need help with home-based care, companion level care, which is what a lot of people need. So we started that. And, for the first year and a half or so, we were running it primarily locally. It went from like 50 students to 100 students, so eventually 1,000 students just at these schools. And then eventually got to like over 2,000 students just in like the Raleigh-Durham area at 3 different universities. Pleased to say within the last year, it's now gone exponential. We have over 28,000 students on the care platform. We are at over 30 different universities, including in your area. We're all over the San Francisco Bay Area and surrounding. We're at UC Berkeley, San Francisco State, UC Davis, Stanford, San Jose State. We're in parts of LA, UCLA, USC, San Diego State, a bunch of other schools. And then we're also all over Boston, Florida, Texas. And it's spread to almost 30 out of the top 50 universities in the country, which is like pretty cool to see. And it's growing very fast. And I think that, some of the unique features of the innovation from the family's perspective are It's very streamlined care booking. So the whole flow is online in less than 2 minutes of just kind of like filling out basic info and then a quick onboarding call with our team. Um, the rates are very affordable. In most markets, it's operating between $20 to $25 an hour. So, in places like San Francisco, traditional like local agency-based care would be 40 to 45 per hour. So it's like 30+% lower cost. And then unique workforce. The students are amazing. I'd say that's probably the best part of the whole thing is that the students have such a vested interest in doing a good job in care that their ratings on the platform are through the roof. Like after, tens of thousands of care sessions, we're averaging like 4.87 out of 5-star ratings, which is like amazing. And it's really because the students aren't just doing it for the money, they're doing it for the valuable life experience. And many of them are proudly writing about it on their medical school applications and their physician assistant school applications and their nurse practitioner school applications. So I think that's been like really cool to see. And that flows back into like quality of the care, just like when you're that motivated and you want to do a good job because it's like a learning pathway for you, you're going to do a great job in the care. They're so reliable. The on-time percentage is through the roof. Like things that happen in the care industry, like no-shows happen a lot in the traditional care industry. It's like unheard of in CareYaYa. So, people are profusely apologetic if they're 3 minutes late, because they got stuck in traffic. So I think it's really cool to see. And then, the final thing is just long-term great relationships are building, I'd say proudest, achievement of the work so far is that, who could imagine thousands of 20-year-olds across the country are spending quality time interacting with thousands of 70, 80-year-olds across the country, helping them day to day, building relationships. And I think that outside of, somebody interacting with their own grandparents, you don't have this as much in society anymore. So I'd say I'm really proud of that, just like facilitating and fostering tons of intergenerational relationships across America. So yeah, that's
besides taking care of like a society issue, a cultural issue of families are all over the place and we don't have that intergenerational experiences together. So that's a plus. The medical profession should be handing you money and students because, as you probably know and you probably experienced, the medical profession doesn't know enough about dementias and that type of care and what it's like to be a caregiver, bringing in your mom like I did, or, your parent or your spouse. Sometimes that's even more of a challenge.
Yeah.
They haven't experienced it. They're in the dark.
Yeah.
And that makes the whole process much more difficult for everybody. So you're like solving problems all over the place. And San Francisco,
I think you're really right about the medical profession part. I think that several people, we collaborate a lot with geriatrics physicians and neurology, palliative care, kind of various fields. And they love the program because they see that there aren't even enough clinical students going into those fields. So they're like, we need to inspire more people to go in these fields because the needs of care are rising. And many of them view it as today's kind of clinical students, because the academic burden is so high, the test pressure is so high, getting the undergraduate requirements, how hard the MCAT is and things like that. People are over prioritizing kind of just like the scientific knowledge, but like not as much of the interpersonal, like bedside manner, if you will. So, and then also the work in the hospitals for the nurse aides, that many of the students would do, during undergrad has gotten so extremely clinical and such short in interaction that spending 10, 15 minutes with a person at, Duke Hospital and going, room to room, you're not really building relationships, So, so I think that many people in the clinical community love our program because they're like, students are learning like deep empathy and they're really learning what it's like to be a person living with dementia and not just looking at them as a patient, but looking at them as a human being and thinking that, okay, they have their own wishes and dreams and memories. And just because in this moment, they may not be able to interact with you in the same way that you might be used to, they're still like a real person on the inside. And I think that that's probably the coolest part of the program is that all these students are learning, okay, these aren't just patients, these are people. And the families, the families that they're helping with, they're really appreciating and realizing like, things like dementia, I would say this from my own experience, things like dementia, things like cancer, it doesn't just affect the individual, it affects the whole family. And I think that's like cool for today's younger generation that's going to go out in the world. And whether they're practicing MDs or physical therapists or physician assistants, now they will have a deep empathy of what this lived experience is like for all these families. And I think that will make them better healthcare providers. And hopefully that'll make them better advocates. Some of these people may one day be in government leading things. Some of them may be setting healthcare policy for the country one day. Some of them, hopefully one day, will rise to the top of hospital systems. And I think that they'll take this experience with them, and, it'll really formative life experience. So, yeah.
Well, we just need to speed that whole process up.
Yes. Yeah, you're right.
So I'm happy to hear that San Francisco State is one of your schools, because that is my alma mater. I obviously didn't go into the healthcare industry. I have a business degree. So um, before we hit record, I was talking to Neil about, I wanted to know how many of his caregiver students, if any of them were in like business, because I do feel like there's benefits that future leaders of companies could learn, but there's definitely a better tie-in with students going into the healthcare field. So we'll have to come up with a good marketing scheme for those business students.
There are more and more now that are going into healthcare that learn business on the side too. I found that many of them will do an undergrad like biology and business, or pre-med and business, and then they'll aspire that I'm going to go into clinical field, but I want to get the business skills because I might later become an administrator, of a hospital, or, something like that. So they do have business interests, but I'd say for the most part, we always look for somebody who wants to go into a clinical route and has like a graduate clinical education in mind. But yeah, there's an increasing interest in the business, because I think the business of healthcare, I hate to say it, is broken. So I think a lot of the students understand that too. So they're like, well, I don't just want to be a provider. Let me understand how business works. And that way, maybe when I get on the inside, I can, be able to change it. So yeah, people are definitely interested in business.
I also think the early introduction to caring for somebody, an older person, even if they don't have dementia, 'cause one of the biggest problems of our healthcare industry, and I'm sure you experienced this because you had at least two different
Yeah.
caregiver roles, is there is no cure or fix or anything easy with somebody living with dementia. Whereas with your wife,
Yeah.
there were treatments, there were things, now she's, healthy again, thank goodness.
Yeah.
Yeah. But, I was where was I? I guess I was online. Where else?
Yeah.
And somebody was saying that a neurologist basically said, your loved one has Alzheimer's. There's nothing we can do. Don't come back. I'm like, we're saying that in 2025? And then a general physician allegedly said to somebody that, we don't, they were looking for answers on like how to deal with the typical dementia behaviors. And if you guys want to learn how to do that, that is a program that I teach through the Alzheimer's Association. So that information is out there. Unfortunately, this this doctor did not know about this. So education across the board is needed again here, but they said, we don't tell you how to raise your children. We're not going to tell you how to take care of your loved one with a dementia. It was like, I mean,
that's
I
like
can understand, but it's like, that's just like hitting them over the head with a hammer. It's just, oh my gosh. And then we don't have enough geriatricians or geriatric doctors in this country. And they're also the lowest paid specialty, which makes no sense to me whatsoever.
Yeah.
I have a past recurring guest. She's a geriatrician in the UK, and she's kind of like yourself. She's trying to disrupt how things are done. And their system and our system are pretty equally broken in different ways.
Yeah.
But she spends an inordinate amount of time getting history and learning about the person and really digging deep to figure out how to take care of things like, well, they were walking fine 6 months ago and now they're practically bedbound, and that doesn't make sense. And she's really, really improved lives of, significantly elderly people in her care. And
Great.
it's like, would like to clone her and bring her over here. But, and she's training younger doctors. They call them different things over there. And it's just, that whole process is so slow. So what you're doing is you're kind of you're giving them a big taste at the beginning of their education and their careers. So hopefully we're going to go back to more personalized care. I think, with the population that we have, especially here in California, we got 40 million people. It's a little difficult to have enough doctors who could spend the time with you to really dig deep. Like when I go to the doctor, it's like, remember, brain health is the most important thing in my world.
Yeah.
I get the cancer screenings and all, but that's pales in comparison. I'll deal with those things. I would like to keep my brain healthy, and I have to remind them that all the time.
Yeah.
And, it's like, because my mom had Alzheimer's, my maternal grandmother had vascular dementia, my maternal great grandmother had some form of dementia. No female cancers, no breast cancer, none of that other stuff. So you can see where my priority will lie,
Yeah.
but it
Yeah.
doesn't, doesn't fit into their box. So
Yep.
we gotta fix that. So how do these students get like training on how to care for somebody with dementia? Because that's a constant learning curve.
Hard. Yeah. No, that's a great question. So, thankfully, like right after we started the program, I actually did another podcast with a geriatrician in our area. And, her colleague had run geriatrics at Johns Hopkins, and they reached out to us and they're like, hey, this is a great program. You guys are scaling across the country. So please stay safe. We ended up getting a grant from Johns Hopkins through the National Institute on Aging to build a very robust caregiver training program. So we've now built that and deployed that, and it's called CareYaYa Guide. And it basically takes the yayas, which are, interchangeably the students or the people getting there, and it basically gets them trained up using personalized learning modules. Similar, we kind of had to figure out a way to take Gen Z and like the way they want to get trained, which is like very different from like, other generations. It's like, like short bite-sized 2 to 5 minute training videos, quizzes, and kind of online learning modules, and then different levels of badges and certifications. So we've kind of like rolled that out, and that's been a cool project. And then now we're collaborating with National Institute on Aging to make that even more robust. So, we kind of do an online assessment of them when they come in. We do video-based interviews of everyone with questionnaires to kind of understand where they are in their care journey and how much they know. Of course, we do other types of vetting too, like background checking and verification of enrollment at university. Then we look for certain cues of what they know about care and really alignment of interest that they want to do this as a way to create a pathway for future clinical career. And then we help upskill them, through these personalized training modules. And then we also supplement that heavily with like long form video as well. And, they can kind of like have the option of like fully immersing into like UCLA dementia and Alzheimer's like training curriculum. So that's been pretty good. We're trying to like talk with a state and local governments in different areas to fully create a pathway to certified nurse aid licensure for many of the students, because I feel like that is the ultimate holy grail of like getting people trained up to get CNAs. But I think that's like a work in progress right now.
Always something to strive for, right?
Yeah, exactly. Exactly.
Um, do you find that since most of your students are going into the healthcare field, do they typically know more about dementias than the average 20 something, or are you having to start from scratch with most of them?
I'd say maybe about 25 to 30% of them know it pretty well. I think part of it is like self-selection, right? Like people are seeking us out many times because they've had this in their family. So a lot of the students are like, my grandma went through this, my grandpa went through this. They know extended family member, uncle, and somebody that's gone through it. So that's why they kind of like will seek it out. So that's many of them. Several of them have even worked in some sort of like senior care industry capacity where they might have like volunteered at assisted living facilities or nursing homes in like high school or even in college. Some have done clinicals at hospitals. So there's like a kind of like affinity to like I want to help older adults, which is why I would like sign up for the program. So I'd say at least a third of people around there are already aware, and then the remainder are like conceptually aware through reading and learning, but like not directly aware. Where this might be their first few times kind of interacting with the older adult community living with dementia. And for those, the training videos are like extremely helpful because like they'll get up to speed quickly enough. Now, obviously, doing the care is like a different, game than kind of you could watch all the videos you want, but once you're in the care situation. But I find that they do learn pretty fast. And I think the critical thing there is that they have like a very learning mindset because they're doing the program not just as a way to help people and make some part-time income on the side, but because they're approaching the program itself as like, I'm going to learn about this, they go above and beyond what we provide them. They'll go and read on their own. They'll ask other colleagues at school, they'll ask professors. So they learn a lot kind of indirectly that way too. So pretty soon within a few sessions, like they become pretty good at it. And of course, the families are also, I think the other cool thing is that the families are a little more forgiving because they know these are students coming in and doing this. And this is not like a caregiver that's been doing dementia care for 20 years, so they kind of know. So I feel like a lot of the families we also find are more than happy to guide the student, through the process. So I think that's been pretty cool. And then the final cool thing is that I actually think in some way it's a blessing because many of the older adults, they view it as like not just this is my caretaker, they also get into it and they're like, I'm helping mentor this person towards a future career. And I think that helps in two different ways. It makes the older adult feel like I'm adding value. It's a mutually beneficial relationship, not just like they're caring for me. And it helps sometimes the adult child of the aging parent socialize the care better. That you are mentoring this young person who's going to become a doctor one day, as opposed to I've gotten you a caregiver. So I think there's like multiple like unexpected benefits.
Yeah, I could see that one because most of us, we grow up to become independent and, we want to take care of things ourselves. And, we might ask for help, but, a lot of us are, have pretty strong independent streaks. And, I was it 8 years ago, flew off my bike and broke my collarbone, which makes
Yeah.
one arm totally unusable, which makes
Oh,
getting
wow.
dressed difficult. And at one point, my family was all gone to work and things that needed to be done. And I'm trying to, make a sandwich, which should be a super easy thing. And basically shoving the plate and the bread over the counter. So I didn't have it a second hand to hold on to the plate. So it was, it was frustrating. And that's a big learning, experience. It's like, dang, it's like I had to teach my husband how to hold the hair dryer so I could use the brush to style my hair. But, most of us don't want to have somebody caring for us. And,
Mm-hmm.
If our kid says, "Hey, mom, I got you a caregiver," that never goes over very well.
Yeah.
So having a purpose is definitely important to their well-being, to the older person's well-being. And, like you said, just the thought that, hey, I'm helping this person become a better doctor. Geez, I think that would lower the resistance factor to having a caregiver. And I wonder if them being younger helps too. I'll have to think on that one. It's like, this is such a wonderful solution. That's why I was like, I've been harassing Neil too. He had to
No, but you're right.
postpone.
I mean, I think you're right. It's part and parcel of the same thing. I think that them being younger reminds me of their own kids often, right? Similar age. Them being kind of like upwardly aspirational and aspiring to something like I want to become a nurse practitioner, physician assistant, doctor helps create this vibe that you as the older adult receiving care are also mentoring them. Also, the generational gap being so different means that you're going to learn things about technology and ask him about kind of like what's going on in the world. So I think that intergenerational relationship and the fact that it really builds a strong social bond as opposed to this is a paid middle-aged person just doing a job, it's like completely different vibe. Completely different vibe. And I think the families love it. I'd say from a older adults who receiving the care perspective, I think they love it because it just like feels so different to them than somebody doing a job. But I think really the adult children of aging parents, to your point, I think they love it even more because it relieves their guilt. It helps them socialize the idea with their parents. Many people introduce care to their parents through a program like this. And I think that they know that their parents otherwise might just refuse care. So I think it's pretty cool.
Yeah, my mom always said, I don't want to be a burden, but I'm going to live in my home forever. And I'd be like, lady, those are mutually exclusive. And she said it all the time. And it was just like, and I moved her to memory care because I was 50. And excuse me, my daughter literally moved out the month before. I was like, no, we're not moving out the kid finally at 25 and moving mom back. No, I've worked very hard all my life wanted to experience the empty nest lifestyle and, everything that's supposed to come with it. But yeah, and I knew that my mom living with me would not be good for anybody, not her, not me, just it was not the right choice. So, but this would have at least made, well, it would have made moving her to memory care even harder because it's like that's not what she wanted. And I knew that was going against her wishes. But I also was concerned that, she'd be at my house all day while I was doing my thing with a caregiver. And, I didn't know what they would do. And, in memory care, she had friends and everything. But at least if I had known about you, you weren't around when I needed this option. So it would have been a really good choice when my dad was on hospice because we had a caregiving company and we used an app to manage everything, but it was kind of the same issues. We had 2 or 3 that were amazing caregivers, probably 4 or 5, because we had 24 hours a day, 4 or 5 that were average, not bad, not great. And then a couple that I had to basically say, please don't send them back. They're refusing to do certain things with my parents, and I just can't have that. So yeah, it was just, ugh. It was like a whole other layer of management too.
Yeah.
So having enthusiasm.
Sorry to hear that. And that we've seen people in hospice use it too. That was like kind of unexpected, but many times, like, actually, interestingly, and I'm glad you mentioned that, some of our biggest competitive advantages are 24/7 care, overnight care, weekend care, because it's shift based and going out to so many different students at different schools. Like, we found, and because the students are happy to do the unusual hours. So if somebody puts in 8 p.m. to 8 a.m., for example, in San Francisco, the traditional care agency will say, I can't easily find midlife caregivers to do that. So if cost of care might be $42 an hour in the market in San Francisco, they'll say, I need to offer it up to like 47.50 to get that overnight filled. You go San Francisco State students, Berkeley students, and you're like, hey, I know it's like baseline 22 during the day, but here's like a 10-hour shift at night. Everyone jumps on that. Like, everybody's trying to take that on the app. They are like, they'll happily do it at 22. They'll sometimes even do it at 20. Like, they'll up for doing it at like lower pricing, because it's like longer hours. And many of them really are trying to get X number of hours before graduate school. So if they're like, oh, I need to get 2,000 care hours before I can apply to physician assistant school, then of course 10-hour shifts helps me get there faster than 5-hour shifts. So yeah, we found like kind of longer shifts, overnights, weekends, same thing, Saturday, Sunday. And then the final thing is there's no conflict with class schedules. So when you have care in the middle of the day during Monday or Tuesday, you have to find which students don't have class on those days. But when you have like a evening, overnight, weekend, no one has class. So we've been able to like just like absolutely grow and like serve that really well without surcharges and markups and anything like that. And I think the students love those opportunities. So yeah, we've started to collaborate with the hospice and palliative care programs. We do a lot of stuff in our area with like palliative care. And I think that that's going to be like a growing opportunity around the country for us.
I'm just amazed, one, that you've put all these pieces together, and it's just like so logical, and it makes so much sense that it is shocking that nobody else thought of it. So how did you actually land on, I'm going to go to healthcare training students? Like, was that just like a logical thought, or how did you go?
Lived experience had actually, I observed as one of the best kept secrets in the care market that, people are manually doing it and they're having a great experience, but you kind of had to churn through so many because you had to go post up flyers yourself at nursing programs, at undergrad campuses. One person couldn't do it all the time, so you had to manage a fleet of people. So I just found it was like one of the more successful things in like the gray market that people are doing on their own. And then on listing bulletin boards, kind of like care.com, where there's tons of caregivers available. Sometimes the healthcare students are like the best and like the most focused. So it's kind of like it already existed, but no one had kind of found a way to streamline it and do all the upfront work for you. See, and I think that's kind of the beauty of this is that people in the gray market who take the matters into hands do end up finding good caregivers, but it's a lot of upfront grunt work. You have to vet all these people. You have to send a million messages. Booking and scheduling is a nightmare. You have to keep on top of text messaging and emails to everyone. So, but they know they're getting a good experience. They're saving money and they're getting good quality care. So if we're like, okay, if we could standardize that through having the technology to do it all for you, and then you just put the days and times you need, and we've kind of made the workforce available, then existing people who do that would shift to using this. But a bunch of people who hadn't heard of that would also shift because, they would have a good experience. So that was kind of like the idea in a nutshell. And I think similar with ideas of like on-demand scheduling and booking, I thought to me, like we started that in like 2021 was pilot, 2022, we rolled it out. I was surprised that in every other industry, whether it's transportation, food delivery, travel stays and things like that, it's been brought online. But this is like a multi-$100 billion economy that is still mostly heavily offline, So I think that, in some way is obvious. You're right. I'm surprised people haven't done it earlier. I think part of it is like the booking trends of people. Like if you think who does like on-demand rideshare, who does like travel stays online, usually it's like younger generation will adopt. And, that's like early adopters. And it's like less personal. It's like, I remember when I was in my late 20s and Uber came out, I was living in New York City. And I remember like a lot of older people were like, I'm not getting in a ride with a random person through an app. But like younger people are like, yeah, sure. It's like whatever, I'm getting in a cab with a random person anyway, right? So it's the same thing. So, we found that those were early adopters. But then if you think about the timeline of when an innovation like this is acceptable to the broader market, a lot of those 28-year-old early adopters are now 45-year-olds and they're needing care for their mom and dad, and same with the people who were 35 back then. So I think that part of it is that as the online gig economy on-demand schedule has moved into more and more personal stuff, like from just ride shares and food delivery to now kind of like home-based care, the demographic that's booking is also growing older with it. And like, they're now like, okay, I'm a millennial and I would consider like my generation grew up using these other things for other services. And now we're becoming slowly the majority of America that's caring for aging parent population. And for us, it's be like the default of where's the online option,
Yeah.
because
It's
people
just,
view it as like tech is like easier to use. It's usually cheaper, lower administrative overhead. There's more transparency on price. It's easier to find information online, booking, scheduling, reviews. There's, you're kind of empowered more, as a consumer, as opposed to like doing it the old school way. So I think that that's kind of like a thing where the buyer base is going to shift. Actually, I think over the next 5 to 10 years, of the buyers of care in America are going to become like millennials. And then a lot of things are going to shift. I think some of the earlier things you mentioned about like gender disparity in caregiving, interestingly, in millennials, it skews much more men. Like I think it's
mm,
approaching almost 40% men, are doing caregiving for aging parents, which is like drastically different from like one or two generations prior. And mainly just because people had less kids, right? So sometimes it's like the only son, and sometimes like son and daughter steps up. I think other times, I also find with millennials, oftentimes both are working. So there's less ability to kind of like do the care yourself. So if you kind of think the ideal use case of like a millennial who is managing maybe their own kids and their own career and starting to take care of an aging parent and may not even live in the same city. That's kind of the other thing, right? There's been a dispersion of population all over the country in the last like 20, 30, 40 years. So that many of the aging parents are not living anywhere nearby kind of the middle-aged kids. So for that demographic, a solution like CareYaYa is amazing because it's like online, available anywhere, tech oriented, tech first, full price transparency, manage everything through app, booking, scheduling, reviews, wherever. So, and not in the same city. So their parent might be living somewhere else. So we have tons of people like that using it. Like, middle-aged lady living in Atlanta is booking care for her mom in San Francisco through our online app and like, sending college students. And then for that demographic also, many of them can relate to the caregivers because they might have kids that are of similar age, that their kids might be in high school, maybe already in college, may have recently graduated college. So they're like, okay, these caregivers are, like my kids or my kids' pre-med friends. So I think that's kind of cool.
well, as an old Gen Xer, I appreciate online booking and everything because I don't have like a traditional schedule. Like
Hmm.
you're on the East Coast, I'm on the West Coast, and my day, I do a lot of stuff by 11 o'clock. And then I start working. So for you, that's like after lunch. So a lot of
Yeah.
people probably think I must be real lazy because I'm hard to get a hold of early in the morning. Two quick questions because I don't want to disrupt your investor call because we know how important that is. What's the genesis of the name CareYaYa?
Oh, thanks. Great question. I want to do something positive and playful because like so many of the names in the industry allude to kind of like needing care and like, ride at home care, visiting angels, things like that. So I want to do something uplifting. So just the word yaya is like the word yeah twice, but it also means grandmother in Greek. Yaya also means caregiver in Hindi and Swahili and Thai. So like many Asian languages. And then I also thought it was a cool acronym for you are your advocate, which I thought was like a future of like self-directed care. So yeah, overall positive, multiple meetings, double or triple meetings, and sounded like a cool techie, future of care.
I assumed that it meant grandmother in some languages, but I like all those other reasons. Where
Yeah.
can people find out about you guys and if you're servicing their area? You are servicing at least close to my area because I'm about an hour away from UC Davis. So hopefully there's some students close by up here because we're a little bit more rural. Well,
Yeah, students are willing to drive typically, depending on length of session. Sometimes students will drive 45 minutes to an hour plus to help with care. But yeah, you can obviously go to careYaYa.org. So www.careYaYa.org. You can follow us on LinkedIn. I'm pretty active on there. So it's Neil, Neal. middle initial K, and then last name SHAH. So feel free to follow me or message me or connect with me on LinkedIn. And then we're reasonably active on like Instagram and Facebook under at We Are CareYaYa. So those are all ways to learn about us. But yeah, happy to help. We're all over the country now. And I think if we're not in your area, send us a message and we can build it in your area if there's a decent school nearby. We typically try to build where there's universities with 5,000 or more students. At some of the bigger schools that have like 15, 20,000 students, usually within a few months, we can have like 500 to 1,000 students ready and available. So
That's mind
pretty cool.
blowing.
It's growing pretty fast. Yeah. And by the way, these students are typically not in the care economy. So it's a net massive workforce expansion to the care economy at a time when we're having major structural caregiver shortages. So it's much needed.
Oh, I knew I wanted to talk to you bad because this is so exciting, and I love talking to caregiver turned creators, but you got to probably be the most innovative one yet. So this has been fantastic. All of the links that he talked about are in the show notes, and I thank Neil tremendously for creating CareYaYa and for coming on today and explaining all the details behind it. Because I think for me that really helps to understand why I would want to use this for my loved ones. My parents are both gone, so I don't foresee a need in the near future, hopefully. But it's just been exciting to learn all the details of the background, the history. So I really appreciate it.
Thanks, Jennifer, for the opportunity. And thanks everyone for listening.